We are here with Scherrie Keating, who is a diabetes expert. Tell us a little bit about what you do.
I actually am the founder of Kare Consulting. It is a new company that I founded. I'm a registered nurse for over 33 years. I'm a certified diabetes educator. I'm a National Diabetes Prevention Program life coach. I'm a CPR instructor and a Pure Haven Essentials independent consultant. So I've taken all those years of experience and expertise in diabetes and cardiac disease, and I founded Kare Consulting. And really my mission is to make a difference in the prediabetes epidemic in this country and to affect change in chronic disease prevention and management through healthy living education.
And what do you think caused the cause of the epidemic that's in America right now?
Obesity and sedentary lifestyles.
And what are some of the things people can do to prevent being pre-diabetic or diabetic?
Well, there are a lot of risk factors for prediabetes. The risk factors are over 45. If you are obese, especially in the middle area, the apple-shaped person versus the pear. Certain ethnic groups are at high risk for prediabetes. If you have high blood pressure, if you have elevated triglycerides, which is part of the cholesterol profile, or low good cholesterol. If you have a family history, mother, brother, sister, father. If you have had pregnancy related diabetes, and if you are sedentary. So what you can do is lose weight, eat healthy, and exercise.
What types of people come to you for advice that you counsel?
Well, actually, my company goes and speaks on prediabetes. I offer a screening. The American Diabetes Association actually has a screening tool, and it's a 7-question questionnaire that people can give themselves a point for each question, and if they add up their points and they score 5 or more, they're at high risk for prediabetes. So from there, they would go to their physician and they would actually have either a fasting blood sugar, which is an 8 or 12-hour fast, and if your number comes between 100 and 125, that indicates prediabetes. The other test you could have is called an A1C, and that's kind of a camera snapshot of the previous 3 months of your blood sugar regulation. And if you're 5.7 to 6.4, then you would be diagnosed with prediabetes.
And why is it important to, get yourself checked beforehand than waiting last minute? I mean, I know a friend of mine waited way too long and then had to go on an insulin pump, actually. Why is it so important to get your numbers and checked while you're still young? Well, maybe you're still in your 30s, or not wait till you're after 45.
Well, let me tell you a little bit about diabetes and the statistics and the prediabetes statistics. There are 29.1 million people that have diabetes. About a quarter of our seniors, about 12% of kids or people aged 20 and older, and we have 208,000 under 20, and 5,000 per year are being diagnosed under 20 with type 2 diabetes. The prediabetes statistics are staggering. 86 million people have prediabetes and 90% are unaware. And we need to increase awareness of this epidemic and reverse insulin resistance, and that's the cause of prediabetes. So insulin resistance is when we're still making insulin from our pancreas, but we're not able to utilize that insulin properly at the cell level, and our sugar doesn't go into the cell like it's supposed to because of the insulin resistance, and that's due to the obesity, especially around the belly, and the lack of regular cardiac exercise. And so what happens is that sugar actually floats around in the bloodstream and attacks the small blood vessels. So diabetes is actually the leading cause of adult onset blindness, kidney disease, and lower limb amputation. So the sooner people become aware that this is really a real problem, what the risk factors are, get screened and get tested.
When you're pre-diabetic, when does it go into actual diabetes? Then you have to go on metformin or insulin.
We have cells in our pancreas called beta cells. And by the time you have pre-diabetes, you've probably destroyed about 50% of those beta cells, which are the insulin-making cells. When you develop type 2 diabetes, you've probably destroyed 80% of them. And that's why a lot of people end up on insulin, because those insulin-making cells are destroyed and they're not working properly. So what I would say is that what the research shows is that when people get diagnosed with prediabetes, 15 to 30% of them will convert to type 2 diabetes within 3 to 5 years if they are not making healthy eating changes and exercise.
So much great information. If people are watching and they want to have you come out to their organization, tell us how they can get in touch with you.
Okay, first of all, my website will be launched next week. It's going to be www.diabetescarewithaK.consulting.com. My email is diabetescarewithaK.consulting@gmail.com. And they can reach me on my work cell, 508-864-5142. And I also have a Facebook page as well.
Excellent. Well, all the information is on the screen. We'd like to thank Scherrie for joining us today to talk about this important issue. This is George for Talk of the Town.